The nervous system. 1. Sensory loss. The central nervous system controls the sensory and motor functions of the body. Diseases of this system therefore lead to loss of some of these functions. Function loss. Other symptoms: hearing, deafness, buzzing or ringing in the ear, tinnitus; sight, blindness, double vision, diplopia; blaring, loss of visual acuity; clarity of vision; sensation, feeling; numbness, anesthesia, tingling or pins, and needles; paresthesia, balance, unsteadiness, ataxia, dizziness, vertigo. Note: there are no common words for loss of or conditions relating to taste and smell. Motor loss. Motor loss symptoms and signs include weakness, loss of power, paralysis, complete loss of power, tremor, involuntary rhythmic movement, especially of the hands, abnormal gait, unusual manner of walking. Speech may also be affected, for example, with hoarseness, a rough, deep voice as in vocal cord paralysis, slurred speech means poor articulation as in cerebral diseases. Loss of consciousness. Patients may describe sudden loss of consciousness in a number of ways. I passed out. I had a blackout. I fainted. I had a fit. I had a seizure. I had a convulsion. Fit, seizure, and convulsion are all used to refer to violent, involuntary movements as in epilepsy. Doctors may say, "When did you lose consciousness?" Here is a passage from a textbook on the causes of loss of consciousness. The principal differential diagnosis is between an epileptic fit and a syncopal attack or fainting. Syncope is a sudden loss of consciousness due to temporary failure of the cerebral circulation. Syncope is distinguished from a seizure principally by the circumstances in which the event occurs. For example, syncope usually occurs whilst standing under situations of severe stress or in association with an arrhythmia. Sometimes a convulsion and urinary incontinence, loss of control of the bladder, occur even in a syncopal attack. Thus, neither of these is specific for an epileptic attack. The key is to establish the presence or absence of prodromal symptoms or symptoms that occur immediately before the attack. Syncopal episodes are usually preceded by symptoms of dizziness and lightheadedness. In epilepsy, people may get warning known as an aura that an attack is going to happen. Note, the noun convulsion is often used in plural form. He had convulsions as a child. The nervous system 2. The motor system. Examination of the motor system should include assessment of the following: muscle bulk, amount of muscle tissue. Look for signs of wasting muscle atrophy. Muscle tone, amount of tension in a muscle when it is relaxed. Tone can be increased spasticity or decreased flaccidity. Muscle power, strength. Coordination, the ability to use several muscles at the same time to perform complex actions. Gait, the manner of walking. Reflexes. See below. Involuntary movements, for example, a tic or a tremor. Here is an extract from a case report about a patient with a tremor. Case 80. On examination, her face showed little or no expression. There was a tremor affecting mainly her right hand. She had generally increased muscle tone, power, reflexes, coordination, and sensation were within normal limits. Examination of her gait showed that she was slow to start walking and had difficulty stopping and turning. Tendon reflexes. Examination of the nervous system normally includes testing the tendon reflexes. For example, the knee jerks with a tendon hammer, also known as a reflex hammer. The reflex may be absent and diminish, normal, or brisk. The plantar reflexes are also checked. The normal plantar response is a downgoing movement, plantar flexion of the big toe, an upgoing toe extensor or Babinski response is abnormal. Coma is unconsciousness with a reduced response to external stimuli. Doctors say the patient is in coma. The patient is comatose. The Glasgow Coma Scale (GCS) score is calculated as follows: eye opening, spontaneous to speech, to pain, none. Verbal response: oriented, confused, inappropriate, incomprehensible, none. Motor response: obeys, localizes, withdraws, flexion, extension, known. Oncology. Neoplasms. A neoplasm is an abnormal new growth of tissue. Malignant neoplasms, cancers, are likely to spread and cause serious illness or death. Benign neoplasms do not spread and are less harmful. When speaking to patients, doctors generally say growth or tumor. Doctor, you have a small growth, or tumor in the bowel. A lump or swelling is a collection of tissue or fluid which is visible or palpable, can be palpated or felt with the fingers. A lump may be due to a neoplasm, but there are other causes such as inflammation or fluid accumulation. Patients say, I have a lump in my left breast. Doctors say there was a firm, palpable mass in their liver. Malignant tumors are characterized by rapid growth and invasiveness. The tumor may invade local tissues or may spread to distant part of the body. Metastasis. Neoplasms, which are the result of metastasis, are called secondaries as opposed to the original tumor, which is the primary. We have the results of the scan back now, and I'm afraid they show that you have a small growth in the prostate. Fortunately, it appears to be at an early stage and there is no sign of spread. So if we remove it, there is every chance of a complete cure. Note: to invade verb is to enter and spread throughout a part of the body, and this process is invasion. Now, if a tumor is described as invasive, it has the ability to spread. Symptoms and signs of malignancy. The symptoms of malignant disease may be related to the size and location of the tumor. For example, a space occupying lesion in the brain causes raised intracranial pressure and symptoms such as headache, vomiting, or visual disturbance. Tumors of the colon may obstruct, block the lumen and cause change in bowel habit. Other possible symptoms of malignancy include bleeding, pain, and weight loss. Case 55. A 33-year-old man presented to his GP complaining of a painless lump on the right side of his neck, which had been present for about 2 months and was enlarged. He had been feeling generally unwell and had lost about 5 kilograms in weight. He was also complaining of night sweats. He had no significant past medical history. Treatment of tumors. A tumor can sometimes be completely removed or excised by surgery. If this is not possible, for example, if it has already metastasized to other parts of the body, it may be possible to destroy it by radiotherapy or by chemotherapy. When a cure is not possible, palliative treatment is given, which is only intended to relieve symptoms.